Hello, lovely ladies. Welcome to your virtual Body and Soul Becoming a Mom session. Today, we are going to discuss things to avoid during pregnancy. This is not going to be a long video, just some snippets of what you should know. And I will send you ladies the packets of the handouts from today's session. So, we're going to begin with our moment of reflection. So, place your hands on your bellies. I'm going to do this with you. For those of you who are not expecting, place your hands on your knees as I am going to do. Close your eyes. Let's inhale. Hold, exhale. Again, inhale. Exhale. And with the last one, I want you to inhale positivity. And exhale negativity. Just sit for a moment and be one with yourself and with your baby. Think about all of the love that you have for your unborn child. All of the goals and aspirations you have for his or her life. Think of how that baby will be so dependent on you. He or she is going to love you, and you are going to love he or she. Just take a moment to reflect on the love and the joy of pregnancy and waiting for your baby to arrive. Let's take one more inhale and exhale. Perfect. Okay, hopefully you feel a little bit more relaxed than you did coming into the session. So I'm just going to show you quickly this flyer that I have. Keep your baby in the no smoking section, okay? So this is one of the handouts that I'm going to be sending you ladies. Secondhand smoke is very, very, very sensitive for babies. It's almost like they smoked themselves. So secondhand smoke can cause the babies to be delivered too early. It can cause them to have breathing problems, and you yourself will have problems as well. It can also have sudden infant death syndrome, which happens for no reason, but when there's secondhand smoke around the baby's lungs, they can't handle that capacity of smoke. So just be mindful of that. Babies will have asthma or other respiratory problems. So try to avoid smoking. If you yourself are smoking, try to cut back. We do have some information for you, like New Jersey Quit Line, which can help mothers to quit smoking during pregnancy and hopefully for good. Also, if you are around someone or in a home with someone who smokes, just kind of let them know if maybe perhaps you can go outside. And we know some people are going to say, this is my house, you can't tell me what to do. Granted. But if you can just let them know that you are having a baby, of course they should know. And it would be helpful if they could not smoke around you. And you can tell them what will happen to your baby if they do. So they can go outside, they can put on a hoodie and even put up the hood so that the smoke does not get into their hair. So let's go back a minute. What is secondhand smoke? Secondhand smoke is when someone else is smoking around you, not you yourself. And so, again, just ask the person to maybe take a step outside, maybe wear a hat if they're going to smoke so that the smoke does not get into their hair, which is called third-hand smoke. Third-hand smoke is the thing that's in the curtains, it's in your hair, it's in your clothes. Some people will say, well, I only smoke in the car. Right, so that smoke is in the car, so when the babies get into the car, they are inhaling that third-hand smoke, okay? So I will send you the information for secondhand smoking, okay? And the next thing I wanted to present to you is that we do have this 7-day plan to quit smoking. So if this is for you, You can look through the packet and find ways to quit smoking. Perhaps you want, like, there are some resources. Perhaps you want to give this information to someone else that you know and love. And at the end of the 7 days, you can let them know that they will get a reward for the quitting smoking for the 7 days, okay? The next thing that I just want to touch on briefly is drinking. Okay, so some doctors will tell you that it is okay for you to drink during pregnancy. Absolutely not true. One glass of wine can hurt the baby. Any amount of alcohol can hurt the baby, and you can lead the baby to having fetal alcohol syndrome. And that's a syndrome where the babies don't develop mentally fully. They don't completely mentally develop. They have behavior problems. You can tell the difference between a child with fetal alcohol syndrome and a regular child who does not. I will also send you that picture. So what happens is this part of the baby's head is very flat, okay? Here, as the speaker who taught me about this, as she said, we want to think of this as God's fingerprint, right? So if you put your finger here, you'll see a little dent right there. Babies who have fetal alcohol syndrome is very smooth here. So another thing you can tell is if you take your finger from the corner of your eye, it should meet the tip of your ear, right? So those children who have fetal alcohol syndrome, when you do the line here, their ears are maybe like down here. So you can see the significant difference between a child with fetal alcohol syndrome, all because mom decided to drink, or mom didn't know any better, or the doctor told her that she can drink. So drinking is not good. That's one thing to avoid. After you have the baby, if you want to take a sip or two, not become an alcoholic, but if you want to take a sip or two, please feel free to do so, okay? Another thing that I want to talk to you about during pregnancy is street drugs. So I am going to send you ladies this handout as well. Okay, so you can look forward to seeing that smoking, alcohol, and other street drugs during pregnancy, okay? So some moms will say, okay, well, I smoke weed. Is that okay? Absolutely not. I'm going to show you this paper. I don't know if you're going to be able to see it correctly, but as you see here, babies are still developing at every stage of pregnancy. So if mom has a drink, or smokes weed, she has to keep in mind, and I know this is backwards for you, but I'll send it to you, that the eyes are still developing. You see that? The lower limbs are still developing. So many things can go wrong when you are smoking or using street drugs during pregnancy. Not even if you smoked, drank everything all day, every day, and your baby could come out fine. But wouldn't you rather not take that chance? So another thing I wanted to share with you ladies is viruses and infections, especially amid the COVID-19 pandemic. If you think you have any infections, you need to go to the doctor. That's a UTI, any kind of pain during urination, coughing, just not feeling well. Call your doctor and let them know what your symptoms are. With the COVID-19, if you have a cough and a fever, call your doctor and ask for a test for COVID-19, and they are equipped to handle COVID-19 with pregnant women. You will be isolated in a certain ward while they test you and make sure that your baby is okay. So just call your doctor, okay? And so how can you prevent your risk of getting any viruses or infections outside of COVID? What you can do is actually you can make sure that all of your food is cooked. When you're prepping, say, your meat and vegetables, don't prep them on the same prep counter. Make sure you're constantly cleaning and wiping down the area that you use, especially for meat, because you don't want to run the risk of salmonella. So make sure you're cleaning every area, washing your hands as frequently as you can for 20 seconds. You can sing the happy birthday song. You could say the ABCs, whatever. Just 20 seconds washing your hands, especially after touching uncooked raw meat. Okay. To prevent from getting STDs. Of course, you can use a condom. Yes, it's okay to have sex during pregnancy. Use a condom, okay? You don't want to run the risk of getting an STD or an STI during pregnancy, okay? Let's see. Oh, get vaccinated. Very, very, very important, especially right now. You want to get the flu shot, okay? You want to get the pneumonia shot. Check with your doctor first, of course, to make sure that you personally are able to receive these vaccines, okay? So that's the paper that you're going to receive. And is there one more thing I'm going to give you, ladies? Let me see. Yes, chemicals and work safety. So I'm going to send you ladies this as well, okay? Chemicals and work safety. So how to avoid chemicals during pregnancy. So you want to avoid the cigarette smoke. You yourself, you want to try to cut back. Say you do a pack a day, try to do a half a pack a day, and then so on and so forth, okay? This includes secondhand smoke and third-hand smoke. You want to try to avoid people who are, if you're out in a gathering, I know we're all in isolation right now, but if you so happen to go to a store and someone is outside smoking and you have to stand next to them in line or something like that, that's secondhand smoke. Try to avoid that. That third-hand smoke, which is in the cars, in the homes, you know, remember to ask your friends and family and partners to go outside. Don't smoke in the car. Put on a hoodie, put on a hat so that the smoke does not get into the fibers of their clothing. Okay. Let's see. What can you do to help protect yourself and your baby? Give you a minute to think there. Okay, so what you can do, of course, don't smoke. Ask people not to smoke around you. No alcohol during pregnancy. You don't want to take that chance, okay? Wear gloves and a face mask if you need to, okay? If you are feeling sick, okay? If you're not feeling the best, and maybe it's just a common cold, make sure that you still wear a mask so that you do not infect anyone else. Wear gloves when going to a store, when touching a shopping cart, okay? To protect yourself as well as others, okay? And make sure your work clothes, depending on where you work. Some people work in a chemical plant. Some people work in a hospital. Some people work in an assembly line. You know, you want to wash those clothes when you get home. Make sure that you're washing your work clothes so that the chemicals are not still there, okay? So that is all that I have for you ladies today. I hope that you enjoyed our virtual session. I am going to now read your message of inspiration, which is much needed during this time, okay? As well as play your song of inspiration, especially during this time, okay? So let me get your message of inspiration. Okay. And we will go from there. I hope you ladies are enjoying your time at home, your peace of mind. If you have any questions, please feel free to reach out to me via email at SHUT as in Tom, C as in cat, HIN as in Nancy, SON as in Nancy, at chsofnj.org. Okay, any questions, you can email me there and I will respond to you. If you prefer that the handouts be emailed to you, I can do that as well. Okay, I'm also going to write my email address so that you can have it. Okay, so your message of inspiration for today is: what will you look like? How will you be? Will you look like daddy or me? 10 little fingers and 10 little toes, a wrinkled up forehead and a cute button nose. You will be crying with that first cold touch, and so will I, because I love you so much. And that was by Wendy Dalkey. Enjoy, ladies. Stay safe, stay home, and I will see you at the next session.